Hi, this is Dr. Saxena, and I've been working on a field called integrative medicine. And though we are a group of doctors, we are all kind of board certified doctors trying to work on different things as such. We were emphasizing more on something like nutritional medicine. We are trying to emphasize more on how best we can, instead of these prescription medications, what are the best things which we can give to the patients. And we are in this thing for so many years now, more than 2 decades. And it so happened we all like-minded doctors. There are about 200 plus group of doctors which we are had worked on this. And during this pandemic, for the last more than a year now, we have been talking to amongst ourselves, and we were able to put across a proposal to the ICMR, telling that importance of following a protocol which involves high dose of vitamin C. We have got vitamin D3. We have got something like melatonin, as well as some antifungal, as a sustainable, cost effective and a viable alternative. We are not telling this is a standard, should be a standard therapy. This has to be followed along with the other stuffs what we are using. So see this simple complements which can be applied can be a game changer in controlling and combating this pandemic. We had our kind of experience with what we were doing with high dose vitamin C's, which are called now as pro-oxidative therapies, trying to use something like hydrogen peroxide. Hydrogen peroxide, I can tell you, the most simple antiseptic we used to use in the childhood days. And we had seen how this kind of bubbles which used to come. I still remember putting the hydrogen peroxide in the ear, and you can see that kind of wax which is coming out, that foamy appearance, which this is again because of that high oxidation. So we talked about, we picked up a lot of studies which were showing the effectiveness of this high dose vitamin C, vitamin D in a slightly modified protocol. We tried talking about this other stuffs also. And we somehow, when I start with the vitamin D, which is now we have a lot of studies, and this vitamin D is acting as a immunomodulator. And immunomodulator in the event of a virus infection makes a lot of difference. It's not just, vitamin D is not just for rickets. And we as a medical graduates used to believe that vitamin D should be given for rickets as well as and there are good sources of vitamin D. Somehow people are not aware about what is the richest source of vitamin D and all that. I used to believe there was a milk is a good source of vitamin D, but it's not that. It is the we need to go and sit in the sunlight. And being the tropical country in India also, I have seen a lot of people, my practice into autoimmune diseases, cancer and the other chronic diseases, warrants the patient, every one who comes to see us, we want to know what is the vitamin D level with them. And to horror, people without any, we picked up some asymptomatic people not having any problems, and they too had very abysmal low levels of vitamin D. And so I started working on why this entire population is vitamin D deficient. Is it related only in the nutrition, or is it something like lead toxicity, or is it glyphosate induced? And this is a big research has to be done. I believe it's the glyphosate, it's the lead, and it is the nutritional factors also. Everything is in a combination gives rise to this. This particular vitamin D deficiency is the underlying, is the most common denominator when we look into this. Yes, I'd like to show you one explored effects of vitamin D in the regulation of the immune system. Because it increases the production of antimicrobial peptides, by the immune cells like cathelicidin as well as and beta defensins. It modulates production of cytokines by the immune cells to suppress inflammation. This is the most important relevant thing which is now is that modulation of production of cytokines, thereby averting that cytokine storm at the onset of the cytokine storm. If you are able to give something like 6 lakhs units or 60,000 units of vitamin D, and you can sustain that plasma level for 2 to 3 days during this kind of cytokine storm, during in the ICUs and during any hospital setting also, make sure you give that 6 lakhs arachidol injection IM, or you can give it sublingually, or can be worked out in a simple way by oral 60,000, because when the patient has been on this viral infection and he has gone up to the stage of ICU or in the hospitalization and all that, this is definitely a big reason for you to give that massive doses of vitamin D instantly, because this is the thing which helps in modulating the cytokines, production of cytokines. It nips off that particular thing, and by increasing the antimicrobial peptides, it helps a lot. So one of the studies which were done, it was done in Lancet, and the aim of the studies were done, I can always share that studies with you. There were some studies by Derand Glauner, and the study points out that independently of corona, it has been known and published for years that vitamin D deficiency promotes the development of pneumonia, which is acute respiratory distress syndrome, ARDS. So vitamin D stimulates body's own synthesis of antiviral substances, which specifically blocks the spike protein necessary for the docking mechanism of COVID-19 to the receptor protein ACE2. This is the kind of thing, this is the data. With this, I believe 90% of the deaths can be avoidable, and this is one of the big things which was done. This work was been compiled by Dr. Renu Mahatani, who is a MD practicing in India with some naturopathy background also, and I really thank the getting into the limelight, the role of vitamin D which has to be played in this particular pandemic. And coming down to something like vitamin C, which is one of the favorite kind of stuffs which we always we were in the mainstream medicine, we keep telling that okay, vitamin C and D, okay, vitamin C. I have been asked by a lot of people who are the good friends of mine, pulmonologists and all that, and when I say you are giving 1.5 grams of vitamin C IV is not enough, you have to go up to 6 grams or sequentially to 12 grams or 25 grams. So they say, doesn't it cause kidney damage? So there is a kind of which was always there were some studies which were done, and that was not very done at a proper this one, and they had shown one of the patient who had some CKD, and he had some kind of things. He had a problem with something with not vitamin C. It was problem with some other antibiotics and other stuff. Because of that sepsis and all that, he went into ARF. But I can always tell you, we have done, it's the Linus Pauling orthomolecular treatments. We are talking about Dr. Levy, I can give scores of people. Dr. Lalitanand is a good friend of ours. He's in Mumbai. Dr. Lenny DeCosta, myself, we had done combinedly myself thousands of vitamin C infusions, and I'll tell you, it improves the renal function as such. We had done in some cases where there was a slight higher levels of serum creatine, which also was brought back by this high dose of vitamin C combined with some other protocols and all that. And I'd like to talk about something about this particular stuff called um, role of melatonin in this pandemic. And I am very well convinced about this kind of simple thing which helps in jet lag. And this melatonin, when it used in proper doses, it regulates immune responses and preventing cytokine storms, quelling inflammation and suppressing that oxidative stress. This is the two liners I can always tell. So effectively, it combats viral it combats viral and bacterial infections, and it regulates your blood pressure, which is blood pressure is a risk factor for COVID-19, and improves metabolic defects associated with diabetes and insulin resistance, again is risk factors for severe COVID-19. And it's via inhibition of this renin-angiotensin system, RAS what we call, this melatonin helps a lot. And melatonin helps in protecting this mesenchymal stem cells, which has ability to ameliorate the SARS-CoV infection, against mesenchymal cells, against again this melatonin promotes both the cell-mediated as well as the humoral and immunity, by improving the synthesis, promoting the synthesis of progenitor cells from macrophages and granulocytes, natural killer cells, and helper T cells, specifically CD4 plus cells. And they inhibit something called NLRP3 inflammasomes. Melatonin inhibits that NLRP3 inflammasomes, thereby quietening that storm if at all it's erupting. And mind you, this is the dose which has to be very appropriate here. So a few of the studies which had shown in October 2020, as well as some papers which showed that the melatonin beneficial effects against a variety of viruses, including respiratory syncytial virus, Venezuelan equine encephalitis virus, viral hepatitis, as well as myocarditis, Ebola, West Nile virus, and dengue virus. So based on these collective findings, we believe melatonin may offer similar protection against SARS-CoV, and I have been using for more than a year for my patients, and melatonin is a game changer. So along with that, we advise people to go for something like antifungal treatment, and this antifungal treatment has to be started as early as possible. And when we talk about prophylactic antifungal therapy, I would definitely tell there is a thing called this illness of SARS-CoV is something like a mycoviral disease, which I believe, and there are some people, Dr. Kauf Dogman also believes in that. There are some, we were able to dig into the mycoviral illnesses, and we were able to pick up some of the papers, what has been talked about this mycoviral. What happens here is this virus takes the help of the fungus which is there in the body, because all of us have got some fungi, some bad bacteria, some good bacteria. We have a good set of microbiome. The human body is not just human cells, it has got some bacteria, it has got some fungi, some parasites and all that. So this particular thing is taking the help of, it gets into there's a hybridization is happening. It's a hybrid between the myco is fungal as well as viral, and once this hybrid occurs and it roams into the body, and thereby no antiviral, everything doesn't work here. So you need to start this empirical antifungal treatment as early as possible if you pick up a COVID patient, and you don't have to wait till the black fungus appears. So thereby you can always change the kind of scenario which can help it's basically we feel that these are the few things which are the missing links and it's not being properly marketed. I don't want to say it's marketed, but it has to be in the kind of therapy, at least in the ICU settings and all that, or public should widely be distributed this thing called melatonin, as well as something like antifungal, which is a kind of, and they should be given this kind of high dose vitamin D sachets, along with some vitamin C and all that, in a big way, so that we can always bring back that particular this with somehow with a country as large as ours. And see, healthcare system is not a kind of, it's crumbling right now. We urge the government to approve this particular thing, which is something like, we're not asking for a big thing, we are asking for just 60,000 units of vitamin D. We're talking about 10 to 15 milligrams of vitamin melatonin, a prophylactic antifungal only when somebody turns positive, and vitamin C, which can be given as a tablet form, or it can be given as a IV form as well. We see, so we request you to the best kind of thing, consider this particular thing. And as a group, I, Dr. Praveen Saxena, along with Dr. Lalit Kumar Anande, Dr. Sri Sudha, Dr. Digambar Naik, we have, and a lot of other doctors, Dr. Renu Batani, a lot of doctors, Saji Kesam, all of us, it's a request from us, so that if you can include these things, it will be in the good interest of the nation, and we can absolutely stop this pandemic at this level. Thank you.